Hi everyone. So I've got Staff Nurse Mastura and Dr. Xiao here with me to address some of the questions that you may have. I'm just gonna go on one of the questions that I saw just now to Staff Nurse Mastura. There's a question from Dr. Teh Yvonne. Uh, any tips on head and neck cancers which can be hard to reach or hard to cover, such as in facial or nasopharyngeal cancer wounds?
Yeah. Okay. So sometimes there is if let's say the wound there is quite deep or there is a cavity, especially over the facial area or over the neck area. We usually suggest to use mist spray. You can just put the solutions inside, and then you can just spray inside it, or you can also use syringe to reach to the area as much as possible. And if let's say the area is too big to use a gauze is not possible, so we can also use diapers, either adult diapers. You can modify it and use it as absorbent dressing. So you can, if too much of slough, so usually we covered those fungating wound, the cauliflower type with a lot of slough. We use the diapers if it's too big. Yeah.
Okay, thank you very much. And just wondering, do you find that when patients have fungating wound or malignant wound to be managed at home, do you find that you have to follow up these patients more regularly than patients without wound, or do they normally cope well?
It depends because some of the family member when we visited them, they already manage it quite well. So this kind of patients we don't really have the need to come like very frequent. But for those who are just having a fungating wound, the family member are very anxious, especially itself are very anxious. It's not just assessing their anxiety level, but also depending on their symptoms too. So often the symptoms is not just derived from the fungating wound, but it also can be from other underlying cause. So the visits is depending on their symptoms and also their anxiety level. Yeah.
Okay, thank you very much for that. And Dr. Xiao, it's just a question for myself, really. I was just wondering, now that you're practicing in a new environment and in a private setting, do you get requests for rapid discharges from a private setting? Are there any difference with the cohort of patients who ask for them or who requested this kind of service in your current practice?
Yes, they are referrals. I have to say that in Selayang, rapid discharge is a team um, procedure, as in, as the specialist or the consultant is doing the communication with the patient, uh, doctors, like the medical officer, could already have printed out all the forms, getting the prescription to be written, and while the discussion is ongoing, actually the nurses could already be getting medication from the pharmacy preparing. So it's a team approach. And in private center, is very much doing it alone, and so it takes a long time. Yep.
Yeah, that must be quite difficult for you to to handle then in that case. Yeah, and I was just wondering, do you think well, because we've done quite a number of this in hospitals that have done it for a while now. Do, did do you think the best way to look at quality is that by doing a quantitative study to look at how people feel, or is it qualitative study to look to really explore how they really feel about it?
Yep. Uh, Definitely both would be helpful, and we have actually submitted a research application using the FAMCare questionnaire, and with some open-ended, some qualitative studies, so a combination to look at patients. The bereaved caregiver whom have utilizes the rapid discharge service at Selayang Hospital, so that improvement could be done, and I would say that that would be very useful for quality and service improvement.
Okay, thank you for that. Just going back to Mastura for a bit. There's one question here. Do you have any experience to dress a fungating wound which is close to stoma? We find it difficult to dress it separately, and I would like to get your advice here.
Okay. Yeah, it's actually very challenging if there is a stoma and fungating wound at very nearby area. So what we normally do, we sometimes need to modify the colostomy bag, or we can actually put a gauze underneath, cover the wound first, then only we put the waffle on top of the gauze. So, but it's challenging. You need to put a lot of stoma adhesive around the area to prevent leaking and all that. If let's say there is a wound on top of or together with the stoma area, it's really challenging because both together. So I have an experience where we have to do our DIY the colostomy bag basically using a plastic bag so that it's actually covered everything.
Yeah,
Yeah.
I'm sure it's more of an improve as you go sort of thing when you're there, isn't it? And problem solving on the spot. Yeah, I'm sure that's quite difficult. Yeah, and one last question to Dr. Xiao. Is there a way to minimize rapid discharge? So I think they're asking, is there a way to make the process easier?
Um, yes. So if looking at the components of rapid discharge, it is quite complicated. And sometimes if thinking that patient only goes home for a day and they die within a day, do they actually need so much of discussion, medication? But again, because of the uncertainty in prognosis, and yeah, so I guess the process is still as such, and I think feedback from our doctors, even as a team, they do find that the process is in a way complex. And I think, again, for research purposes, in terms of quality improvement, it would also be something for us to look into. So people whom doctors, nurses, whom have utilized the guidance, what do they think about it?
Okay, okay. Thank you very much for that, and thank you very much, both of you. It's been such an interesting session. So we'll have a break now, and if everyone can come back here at 4:10, 10 past 4 for the next session. Thank you very much.